Good afternoon to everyone. Pranamas to His Holiness Jagadguru Sri Shivaratri Deshikendra Mahaswamiji. I hope all for YUKTI 2021 and 2022, an online case discussion series organized by the Department of PG Studies in Panchakarma, JSSAMC College, Mysuru, especially for the final year BAMS students, for internees and postgraduate students. YUKTI 2021-2022 is a 10th session of case discussion series, and we are already halfway through it. So last week, we had a privilege to hear from Dr. Srilata Kamath ma'am from SDM Udupi, who gave us a detailed insight regarding the differential diagnosis and treatment of the disease Uttana Vata Rakta. And today, for the 6th session, we have another eminent speaker, Dr. Jikesh PP, Professor and Head, Department of PG Studies in Panchakarma from VPSV Ayurveda College, Kottakal, Kerala. So I hereby take this opportunity to give a brief introduction regarding the speaker. So Dr. Jikesh PP, born on June 1st, 1972, completed his BAMS from the Vaidyaratnam Ayurveda College, Ollur, Calicut University in the year 1996 and completed his post-graduation from the Department of Kaya Chikitsa from Government Ayurveda College, Thiruvananthapuram, Kerala University in 2001. So he is presently working as Professor and Head in Department of Panchakarma, VPSV Ayurveda College, Kottakal. Sir is a member in PG Medical Board of Studies, Kerala University of Health Sciences, as well as Calicut University. Sir has so far published more than 10 articles in various national and international journals. Sir has also delivered lectures on various topics organized by the Ayurveda colleges throughout India. So far, Sir has guided more than 13 research works, and he also has a vast academic as well as a practical experience of more than 15 years. So today it's our privilege to have you here, sir, and we are eagerly ready to hear from you. So I once again wholeheartedly welcome you for the session, sir. Thank you. So you may take the session, sir.
Okay. Shall I share the screen?
Yes, sir.
I think it is disabled.
No, sir, it's enabled.
It's showing that the host disabled the participant screen sharing.
You can try it now.
Okay, now it's okay.
Yes.
So, good afternoon to all. Respected Veena ma'am and other dignitaries and dear friends.
Sir, can you make it as a slide share?
Okay. I will do. Is it okay?
Yes, sir.
So I'm very happy to be here. I would like to congratulate JSS College for organizing such a different program, case discussion series, YUKTI. And I express my gratitude for inviting me for this session. Actually, it's not in a proper case report format. Two cases which we have seen, we have admitted in our college hospital and got some improvement, a significant improvement I have recorded. And only the necessary details I have entered in the slides. And also there is no discussion part for that. Generally, when we write a case report, it should have a format. So very sorry to say, I have not done in such a format, but the necessary details and what all treatments and medicines used, etc., are being written in the format. Anyway, the other things we will go in detail. So the first I would like to share a experience with Bell's palsy. So as per the modern medicine, they say that the complete recovery can occur within several months to a year. And sometimes unfavorable functional and cosmetic outcomes can occur in facial palsy. In certain patients, if it persists for a long time, it always creates some problem. So the facial asymmetry will be there. So such cosmetic issues will be there. And also, if the eyes are not properly closed, it can lead to potential eye injury also. And certain other long-term sequelae also can occur in facial palsy. And this is a conclusion given in an article. So they have concluded that no recommendation can be made regarding surgical decompression for patients with Bell's palsy. No recommendation can be made regarding the effect of acupuncture in patients with Bell's palsy. And no recommendation can be made regarding the effect of physical therapy in patients with Bell's palsy. Of course, it's not about the Ayurveda, but it's about the physical therapies. But we have some similarity with the physical therapies, where the physical measures are used to treat a variety of conditions in a different manner. So this is what their conclusion. So here I am presenting a case in which we got very good improvement within a short period. So it was a case of a 34 years old male. He was working abroad, and during the COVID situation, he returned to his native. And he presented with the deviation of mouth to right side, and he was unable to hold air in mouth, and also he was unable to shut left eye completely. So since 10 days. It was an acute onset, noticed while woke up in the morning. There was no history of fever or trauma, no history of herpes virus infection. There was no history of diabetes, no hypertension, and no dyslipidemia. So when he noticed this deviation of mouth, he consulted with a neurologist, and from there they tried the modern medicine, including the oral glucocorticoids, for 10 days. And only minimal improvements were there. So he consulted in the nearby government Ayurveda dispensary, and from there he was referred to our college hospital. His appetite was good, sleep disturbed, addiction nil, and bowel functions and bladder functions were normal. There was an exposure of intake of cold juice nearly 3 days. 3 days continuously he was taking juice, very cold juice. Then also he presented with he told about the sleep on the floor. So these 3 nidanas were observed in the patient. And on examination, there was gross asymmetry of face, deviation of mouth to right side, and incomplete closure of left eye. On examination, systemic examination, cranial nerve examination, only the facial nerve examination I have included here. So there was absence of wrinkling on left side, and easy opening of closed left eye was present. He was not able to resist the movement. So the patient is asked to close the eyes as the soap has gone in the eyes. And we tried to open the eye. So it was very easy to open the eye. And he was unable to blow cheek against the resistance. There was deviation of mouth to right side. The angle of mouth was deviated. And Bell's phenomenon was also present on the left side. And no objective evidences of taste, lacrimation, or auditory disturbances were there. So this is the picture. Here you can see the angle of mouth is deviated. So here he was not able to close the eyes completely. Bell's phenomenon was also present. Here you can see there is absence of wrinkle. Only here, up to here, you can see the wrinkles. From here, it was absent. Totally, there was absence of wrinkle on the left side. So there is a grading system for facial nerve palsy, which is called as House-Brackman facial nerve grading system, in which there was 5 gradings. First is normal, second slight, third moderate, fourth is moderately severe, and fifth is severe, and sixth total. There is no facial function. So here actually gross there was little movement was observed, and asymmetry of the facial appearance is there. Forehead no movement, eye incomplete closure was there, and mouth slight movement, only slight movement was possible. So the grading, he was graded as 5 or House-Brackman facial grading. So we took it as extreme Vadagoba, considering the Nidana, and also minimal involvement of Kapha also, as the Nidana included Shida and Mathura, that is intake of cold juice for consecutively for 3 days. It was taken as there is minimal involvement of Kapha. All other Nidana contribute to Vadagoba. So extreme Vadagoba was assumed related to the Sira Snayu connected to Shiras. And the condition was almost nirama. Of course, there was minimal association of kapha, but no other rama symptoms were observed. So it was considered as ardhita. So coming to the treatment principles, these are the treatments given in the text. Vagbhada gives Navana, Murtha Taila, Shrotraakshi Tarpana. Ardhidaya Navanam Murthani Tailam Shrotraakshi Tarpanam. Along with that, we have to consider the treatments explained for Shirogada Vadagoba, Gada Vadagoba also. So in that, additionally, we can see the Shirovasti and Dhumavana is also explained. Then, according to Charaga, Navana, Murthani, Taila, Nadi Sweda, Upanaha, and Auttara Bhaktika Sneha is also included. Again, it is in the when Vada is vitiated in the Shiras. As per Sushruta, it is some more detailed. So first he explains that Vada Vyadhi Vidhana can be taken or can be administered in Vada. Then in addition to that, Mastishka, that is Piju, then Shirovasti, Nasya, Dhumavana, Upanaha, Sneha, Nadisweda, etc. are mentioned for treating the cases. So all the treatments may not be essential in all cases. According to the features, according to the condition of the patient, we can select the treatments. So many type of Sweda Prayoga explained, Shirovasti, Shiropiju, etc. explained. These also, depending on the case, we can select these procedures. So in this case, we have opted only Sirolepa, Ksheeradhuma, Nasya, and Panasapatrasweda. These were done for 7 days only. So Sirolepa was put, Ksheeradhuma was done, then Nasya was performed after that. Then in the evening, Panasapatrasweda was done. So Panasapatrasweda, it is done separately. All other treatments, that is Sirolepa, Ksheeradhuma, and Nasya was performed in the same sitting. So first we put the Sirolepa, then Ksheeradhuma was done as a Sweda procedure before the Nasya. Then after that, Nasya was done. So internally, I will detail the each procedure. Internally, at this time, we have given Dhanada Nayanadi Kashaya, which is explained in Sahasra Yoga. Then 2 BD. Then Amrdarishta Punarnavasava and Mukhamukadavadi Guliga, which is also explained in Sahasra Yoga, especially in Sannibada Goba, where especially it is Vada Kapahara, Amahara, Also, it is Vata and Lomina. So these medicines were given internally. So Sirolepa we did with Karpasastyadi taila and Rasnadi churna. So Karpasastyadi churna taila is taken, in that Rasnadi churna is put, and it is slightly heated. When it is cooled, it is put over the vertex. So this is done in the patient. Karpasastyadi taila, as all you know, it is also from Sahasra Yoga. It was put for nearly 1 hour. So almost after the Nasya only we have taken this Sirolepa. So this is about the Sirolepa. Then Ksheeradhuma, we used the Balamula Ksheera, and using the Balamula Ksheera, the Nasya-Karpasastyadi was done from on shoulder, neck and face. It was done as per the procedure of Ksheeradhuma. It was done only for 15 to 20 minutes. It was done. After that, Nasya was performed. So on the first day, we gave only 1 ml of Nasya. Then on the second day, we increased to 2 ml. Then on the third day, we did second installation. In the same sitting, 2 times Nasya was performed. So first we have done the Nasya-Karpasastyadi, Nasya was performed. After the spitting out, when the medicine is gone fully, again Nasya-Karpasastyadi done, and the next dose was instilled. So as per the text, Dvitrirva Nasya Acharil. So up to third installation, it is explained. Till we get the Samyak Lakshana, you can do the Nasya. So 2 or 3 installations you can perform. So from third day onwards, we have done 2-time installations with the 2 ml per in each nostril. This is in the same nostril, 2 ml. Twice we have done. So like that in 2 nostrils it was performed. For Panasapatrasweda, again we have used the Karpasastyadi taila. Karpasastyadi taila was applied over the ripened jackfruit leaves, and using that massage was done on the affected side. On the deviated side, it was done in the downward position, and on the affected side, it was done in the upward direction. So this was the this is usually done like that, and up to 15 to 30 minutes it was performed. So this is about the Panasapatrasweda. These leaves are smeared with oil, and it is heated. When it is heated, it is used to massage. So on the actually here the deviation was to right side. So on the right side it was done in the downward manner. On the this left side it was done in the upward manner. So like that, in a circular manner it was performed. This was done for 15 to 30 minutes. It was done in the afternoon. Nasya was done in the morning session. After treatment. So after 7 days, soon after the 7 days, you can see the changes. This was the first picture. You can see the deviation has reduced considerably. The deviation of the mouth has been reduced considerably. So he was able to hold water or air in the mouth compared to the previous day. So here also, while smiling, there is still some deviation is observed. So, eyes, he was able to close the eyes completely just after 7 days of treatment. See, the wrinkles, he was able to raise the eyebrows, and a little more wrinkles you can see on the left side. Here also you can see some wrinkles you can see on the left side. So it was, the grading was performed and it came to 3. Actually, there was some deviation, but it was not disfiguring the facial asymmetry synchronicity. And normal tone and symmetry. Forehead, a slight to moderate improvement was observed. Eyes complete closure with effort. So he was able to close the eyes, and mouth slight weakness with the maximum effort. It was also observed. So the grading was taken as 3. So these changes occurred within 7 days. Then again, the treatment, because he got discharged. On this, after 7 days, this treatment, the patient got discharged, and he was advised to continue these medicines. Dhanadayanadi Kashaya with the Ksheeradhuma 101 and Siddhamagaradhaja in the night. And along with that, he was also asked to continue the Panasapatrasweda. That was continued in the home itself. Then after 7 days, we changed the medicine as Abhinga was done with the Mahasneha. So after this 7 days Panasapatrasweda, we asked the patient to put Mahasneha over the face and do the Abhinga. As we do in the Panasapatrasweda, in the same direction, he was advised to do the Mahasneha. Mahasneha is from Ashtanga Hridaya Vadavyadi Chikitsa Akshepaga Vidhana, which contains Chadusneha. It is almost, it is indicated for Chadush Prayoga, indicated especially in Gambhira Vadavyadhis. Internally, we have changed as Rasnabala Yashti Ksheeradhuma. So Dhanadayanadi Kashaya was stopped, and Rasnabala Yashti Ksheeradhuma is advised. This formulation is from a famous Kerala text called Yogamrita. Actually, you can see it is a Sannibadahara. Rasna is Kabahara. We can take it as Kabahara, Bala Vadahara, and Yashti Pittahara. So for all dosha predominance, it is best. So this combination was used. This Ksheeradhuma was advised. Then along with the Ksheeradhuma 101. Then Siddhamagaradhaja also we continued for the next 14 days. So after that, you can see the changes. He was completely able to hold the air in mouth. Eye closure was normal. Yeah, you can see the wrinkles on the affected side also. On left side also, the wrinkles, it is normal. It is almost normal. Yeah, almost normal picture. He was also happy with the treatment. Actually, when he didn't get any improvement with the steroids, he was little bit confused. And after getting the treatment from Ayurveda, within 7 days, he was happy. He had very good improvement with the treatment. And just he continued the treatment for next days. After 14 days, he was totally normal. So whenever we asked to take the photo, even in the last visit also, he was asking to us, you need more photos, you can take, like that. So he was totally, he was happy with the treatment. So so grading we did, it is almost normal. You can see the changes. Just a minute. Okay. You can see the changes. This was the first one, that is, it was on 25th November. This is on 2nd. This is after the follow-up. So here the angle of mouth, you can see here. It is totally deviated. Here little deviation is there. Here it is normal. So see here, he was not. There was no wrinkle on the left side, and this figure there is some wrinkles appeared, and in the after the follow-up, you can see the full recovery from the condition. Here, there was little disability to hold the air in mouth. Here, it was normal. So this also, here he was not able to close the eye completely, left eye. Here it was normal. Here also it is normal. So what we observed, we can give fast recovery by Ayurveda. It is thought that Ayurveda will take time, but if we are adopting the actual treatment with considering all the conditions, we can give fast improvement. We can make the patient totally normal within a short period, and no adverse effects are observed. And also cost effective, and of course these type of cases should be documented and it should be published. Of course, we will be publishing this case. So such type of documentation are very necessary in the case of Ayurveda. So this is about the first case. Shall I give the break, or shall I continue with the second case?
You can continue, sir.
Okay. So next is a case of progressive supranuclear palsy. Of course, progressive supranuclear palsy is not easy to deal with. We had a few cases. In most of the cases, we didn't get much improvement. So actually, one case we got admitted in the hospital, and myself and Dr. Subin was also there. So we discussed about the treatment, and we did the treatment together. So progressive supranuclear palsy is a degenerative neurological disorder with uncertain etiology, and it is characterized by gait ataxia, slowing or inability to generate voluntary saccadic eye movements, and axial rigidity. So mostly the patient will be presenting with the gait ataxia, or the patient will be having a falling tendency. So almost similar symptoms of Parkinson's disease can be observed. Bradykinesia, severe bradykinesia can be observed. Speech will be affected. Along with that, the patient will be having a falling tendency. So that should be very keenly observed. It's a fast progressing disorder, and the usual lifespan after diagnosis is 6 to 10 years. And currently, no effective treatment for PSP is available, and usually symptomatically it is treated, but usually it does not respond to medications. And currently focuses on relieving the symptoms. So we had a patient who was 58 years old, male, and he complained of difficulty to walk. He was not able to walk, and the speech was slurred, and he had repeated falls, and occasional nasal regurgitation also was observed for the last 5 years. And it was of gradual onset. Actually, he was a security man. So what he noticed when he wake up from the sitting position, he used to fall. So when this number of falls increased, then he consulted the doctor. He was a non-diabetic since 5 years, non-hypertensive since 1 year, and he was on metformin, glimepiride, and amlodipine. So this is about the timeline of the patient. In 2016, he had and when he consulted a neurologist, he started medication. He had a difficulty in speech also. Then the number of falls increased more than 5 to 7 per day. And there was increased salivation, episodes of choking with the solids and liquid foods. That is, nasal regurgitation was also observed. Then in 2020, he started Sirolepa, and only mild relief he got. and hence he was not satisfied with the treatment. He came to Ayurveda, and first we started the OP treatment. Then we admitted the patient in the hospital. So with the OP treatment, the silaria, the dribbling of saliva reduced, and number of falls also considerably reduced. Still, he used to take support for walking, but the number of the falling tendency got reduced to 2 falls per 10 days. With the OP treatment itself, we got that change. Then in 2021 February, he got admitted in the college hospital. No relevant past history was there, no family history, no trauma to head, no exposure to toxins, no history of seizures or encephalitis. And in higher mental functions, there was a reduced expression, and memory, immediate recall was affected. Speech was coherent and relevant but slurred. And the cranial nerve examination in the visual field, upper quadrant was not visible due to vertical gaze palsy. Then in the third, fourth, and sixth, upward movement was affected, and slow saccades was possible. And glossopharyngeal nerve, there was difficulty in swallowing of fluid. Coming to motor examination and sensory examination, bulk, etc. normal. DTR was also almost normal, and he was not able to do the buttoning and make bolus. So the fine finger movements were affected. Then the posterior axial rigidity was observed. He was unable to stand without support. Gait, it was a wide-based gait and hurried, and he used to take support. Coordination, finger nose test was impaired, and dysdiadochokinesia was present. He was not able to do the repeated alternating movements. Romberg's test we couldn't perform, as the patient was not able to stand without support. Then tandem walking was not possible, and there was no involuntary movements. So there is a rating scale for progressive supranuclear palsy. PSP rating scale is there, which include 28 items in 6 domains. So daily activities, mentation, behavior, bulbar, ocular, motor, limb motor, gait, midline, etc. And scores ranging from 0 to 100, with higher scores indicating more severe disability. So this is that rating scale. It is available in the net. So using this PSP rating scale, we assessed the patient before starting the treatment. These are the different components of the rating scale. So 28 points are there. So in each 0 to 4, grading is also there. So in this patient, it was about 31. These are the affected ones. Only the affected ones have been included. So his score was 31. So at OP level, we have given the Idugandha Kashaya. Actually, it was taken as Avarana to Vyana and Prana, because he was not able to take the food. The dharana is also affected. He was not able to balance the position. So prana was considered affected, and totally the movements were reduced. It was bradykinesia was also there. So involvement of Vyana was also suspected. So considering the Avarana to Prana and Vyana, these treatments have been given. First, he was given with the Idugandha Kashaya as a first line. That is, the Devana Pachana was done with the Idugandha Kashaya. Along with that, Bhadrarvadi Kashaya was also given, which is from Ashtanga Hridaya Gana chapter. It's also very commonly given in conditions where the higher mental functions are affected or pranavada is involved. So in such cases, Bhadrarvadi Kashaya is given. Along with that, Ashwagandha Churna was also given, which is also, it is Deepana and Pajana. At the same time, it is Brahmana also, or it is Balya also. Hence, Ashwagandha Churna was advised. And as external, we advised Sirolepa with the Gorojanadi tablet. Gorojanadi 2 tablets mixed with the juice of Nirgundi, and it is applied over the vertex. And Stanya also can be added. Actually, this is traditionally it is done by the family Vaidyamatha. So it was by the suggestion of Dr. Subin. It was carried out. Then after the OP level treatment, he got admitted. And after the admission, the patient was given with the Indugandha Kashaya morning, then Nayobaya Kashaya in the evening. Nayobaya is also good in to produce the Vada Anulomana, also where the higher mental functions are affected, especially the midbrain is involved, or this brainstem is involved. In such conditions, Nayobaya gives very good result. Also, where the dysphagia is also there. So in such cases, Nayobaya and Kashaya gives very good result. So that was also given. Then as the patient was diabetic, Nishakadagadi Kashaya was also given, which is explained in Sastra Yoga. Then Amrita Mehari Churna, it is a Pramehara combination from Ayurvedishala Kottakkal. So these were given in first. At the same time, externally, we performed the Uddvartana with the Yavagola Churna for 5 days. And after 5 days, we performed Dhanyamladhara for 9 days. So after doing these treatments, the patient was getting very good improvement. Actually, he was admitted in the general ward. So the bathroom was common. So it was on one side. The patient was his bed was on the other side. So he had to walk a little to go to the bathroom. So earlier, always he used to take the help of his bystander, his wife. Then after completing these treatments, after completing the Dhanyamladhara, he was able to walk without support. So his wife always assisted, but she didn't give any support to the patient after doing this treatment. So the patient was able to go to the bathroom without any help of the bystander. Then after that, we changed the medicines to Gandharvastadi Kashaya morning, Deshmula Kadatraya Kashaya in the evening, Nayobaya Kashaya at 10 a.m. and 3 p.m. Nishakadagadi Kashaya, again twice it was given. Amrita Mehari Churna was also given. Along with that, we put Marsanasya with the Mulagadi taila. Mulagadi taila. This taila is explained in, actually it is explained in Gada Nigraha or Charaga Samhita also. Charaga Vadavyadhi, you can get the reference of Mulagadi taila. But in Gada Nigraha, the Palasruti, the sloga is totally different. Almost the ingredients are the same, and it is highly Kapavadahara. Contains Bhaladaga, etc. Bhaladaga type of Krishna drugs. It's very good. Actually, we were conducting some trials in Parkinson's disease with the Mulagadi taila. It was a control in one study. So Mulagadi taila was available. Actually, it is not available in the market. So we prepared this Mulagadi taila, and we did Nasya with the Mulagadi taila. For 6 days we have done. And after that, the patient was discharged. Gandharvastadi Kashaya with the following medicines, that is the Gandharvastadi Kashaya. Then we gave a Ksheeradhuma with the Prashnaparni, Shaliparni, and Bhadra and Bala. This is from a text called Navakhanda, which is indicated in Vadavyadhi. This is also from the tradition of Vaidyamatha family. Dr. Subin suggested these medicines. Then we gave Chandanadi Kashaya, which is explained in Bhaishya Reknavali, Mastishka Kshaya Prakarana, Mastishka Roga Prakarana. Chandanadi Kashaya was given. and Nishagadagadi, Toya Paga was advised. Then Pradimarsha Nasya with the Kalyana Krita was advised. Ksheeradhuma for Ashchudana for putting in the eyes, it was advised. Then Rasna Deshamuladi taila was advised over the head. So this was the discharge medicine. And after 1 month, the patient was able to stand and walk without support. And the rating scale, it reduced to 18. From 31, it became 18. Then there was significant improvement in gait arising from the chair, postural stability, and sitting down also. Then number of falls reduced to 1 per month. So the last month he had only 1 fall. Nasal regurgitation was absent. Tandem walking and finger nose test became possible. And the upward movement of the eye became normal. And there was also slight improvement in the speed of eye movement. So as a conclusion, PSP, it is a need of finding out more effective way to treat. It's very difficult to manage the progressive supranuclear palsy. Actually, only in this case, we did the treatment with a prior plan. So we discussed together and we performed the treatments. And of course, the treatments, the grading, everything was performed by the PG scholars. So they were also curious about the case. So they graded regularly. They visited the participant and taken the score. And so Ayurveda treatment can be used to prevent or reduce the disease progression and improve the quality of life of patient. After that, actually, the patient had a fall. In the next month, he had a fall. But after that, the patient was saying that he has some increase of the symptoms. So after that, he didn't come for the follow-up. So up to the first follow-up, we had this much improvement, it was noticed. Then after that, we didn't get the follow-up. But anyway, we feel that this line of treatment is effective in PSP cases. So such, I think this Dhanyamladhara and Mulagadi taila Nasya, these two are very, have given very good improvement with this case. Thank you. Shall I stop sharing the screen?
Yes, sir. You can stop the screen sharing.
Thank you, sir. Thank you very much.
Thank you, madam.
Yeah, thank you very much. As you have shared the knowledge of treatment of Bell's palsy and even the progressive supranuclear palsy. It shows the in-depth knowledge regarding the selection of the very specific therapy in the particular cases. So we have some questions from our PG scholars regarding the treatment. The first question is the significance of using Amrita Arishta and Punarnavasava in Bell's palsy.
Actually, it is not related to it is not related to the Ardhida. Generally, it is we observe the as per the modern facial neuritis is the most commonly seen pathology behind the Bell's palsy. So considering that, we have given the Amrita Arishta Punarnavasa in the first stage. And also you can see that in many of the acute conditions of Vata, where the higher centers are involved, the pathology can be connected to Sannivada Jwara Chikitsa also.
Okay.
Because, say for example, if we take the Pakshaghata or such type of treatment, such type of diseases, in the acute stages, generally the medicines given are Gaurajanadi Guliga, Supranuclear Guliga, or Brihat Kasturi Bhairavarasa Guliga, or this Vyakri Kashaya or Bhadrarvadi Kashaya. These are explained, and also externally we adopt the Sirolepa type of treatments. Actually, these are observed, or the context of these formulations is Sannivada Jwara. So maybe the similarity may be like that in Sannivada Jwara also the Mastishka gets affected. So here also it may be the reason where the site of lesion is the same. So that may be a reason. So like that we first gave the Amrita Punarnavasa.
Whether it will going to reduce the local edema in the Amrita and inflammatory edema.
Is there, it can reduce. Amrita Punarnavasa in such cases it is given. Even when there is joint inflammation is there, Amrita Punarnavasa is given. The combination is given.
Actually, in Bell's palsy, you have taken the Bhadradarvadi, Dhanadanayanadi Kashaya.
Yeah.
And in this Bhadradarvadi, how can we differentiate the selection of these two Kashayams in this?
Dhanadanayanadi Kashaya is more Tishna, Ushna, and Kaphavadahara. It almost all the drugs are highly Tishna. Dhanada Nayana Shundi, Shigru Rasna, Ugragandha, Varana Leshina Krishna, Chitraga Erenda Gaisha, Surataru Khanapatya, Barbarai Sambradampa. So all the drugs are highly Kapha Vadahara. Kapha Vadahara, Tishna and Ushna. So generally in the first stages where the Avrana is there, Dhanadayanadi Kashaya is best. Bhadrarvadi, again, it also work in the avaranas of prana, but most probably it may be working in the next stage. So that's why it was given in the next stage. First we have given the Dhanadayanadi Kashaya, then we no, actually in the Bell's palsy only Dhanadayanadi Kashaya was given.
Yeah. And in Supranuclear,
PSP was given. Bhadrarvadi is again in Avarana, especially Avarana of Vyana and Prana, we can give.
What's your opinion regarding Ashtavarga Kashaya in this case, sir? In
Ashtavarga, again, Ashtavarga it's effective in where the Avarana to Vyana is there. But this is my feeling. This Bhadrarvadi and Dhanadayanadi will be working in the prana level also. Ashtavarga will be more suitable in Jnana Avarana.
Yeah. Sir, one more question, like, can any basti be given in progressive supranuclear palsy? You can plan for any basti.
Actually, we didn't try because the patient was, we got very good improvement with the treatment. So only with Uddvartana, Dhanyamlatara and Nasya, the patient was able to do his normal activities. So what we thought, we stop the treatment now, and after 6 months again we will admit, and we will go for other treatments like Vasti or other. So, but unfortunately, after that we didn't get the follow-up.
Sir, one more is like you have given 2 sittings of Nasya.
Yeah.
So can that be done in only one sitting, the 4 ml?
Yeah.
Why 2 sittings? What is any rationality or?
No, actually it is Abheshajakshayadevam Distrirva Nasimajari. So that is the explanation given in the text. So the Nasyaviti, in the Nasyaviti itself, it is explained that you can do 2 to 3 times the Nasya. So you have to divide the dose into 3. Sangraha, in Sangraha, it is clearly explained. You have to divide the total dose into 3. And thrice you can do the Nasya. So that was followed. Only 2 installations we have done. In certain cases, we perform the 3rd installation also.
So is there any gap between the 2 installations?
No. Only after, when the patient is ready, after spitting out the kapha, if the patient does not feel that still kapha is there, then we go for the next Nasya. Nasya again done, and the next dose is instilled.
One more question is, why that Panasapatra is ripened and why not a fresh green leaf? Panasapatrasweda, you have very specifically.
Yeah. That exactly I cannot give the answer. But traditionally, this Panasapatra ripen Panasapatra is having more Vadahara property. Exactly, I have to refer that. What is the significance of this ripen Panasapatra? That I have to see. It is considered as more Vadahara.
Sir, what is the diagnosis of supranuclear palsy according to Ayurveda? What type of, whether avarana, anyonya avarana? Like,
I just told about that. We took it as avarana to vyana and prana. Nishwasa, Uchwasa, Samrodha, Stevanam, all these may be affected. The patient was, occasionally the patient was having the nasal regurgitation. So dysphagia was also there. And also the balancing, the dharana of the body, that is also contributed by the pranavayu. So that was also affected.
sir, thank you very much for sharing your knowledge and even discussing regarding and clearing the questions asked by our PG scholars. So we are highly indebted that we have a great privilege of hearing to you, because the Kerala is very famous for the selection of particular varieties of Sweda and therapies in very specific varieties of treatment in different disorders. So thank you very much, sir, from the Department of Panchakarma, JSS Ayurveda Medical College, Mysore. Thank you, sir.
Thank you, ma'am. Thank you, ma'am.